Good afternoon, everyone. I understand technical corrections have been made, so we're all set. Sorry for the delay in getting started. I hope you all had a magnificent Thanksgiving holiday with your families. It was great to be able to gather in person. My family was fully vaccinated and fully boosted, so I felt very secure with them. And it was great to see my father, who I hadn't seen in a long time, from Florida. So now we've officially begun the holiday season. We know what that looks like. It's an exciting time. It's a happy time. But it's a time of caution for us right now. People will be gathering more indoors. People are traveling more. People are seeing family members they haven't seen in a long time who may or may not be vaccinated. So we'll be talking about some of those issues in a few minutes. But right now I wanted to talk about the new variant, which has been dominating the news. We are watching this very closely out of South Africa, watching to see whether or not there is a case here in New York. I said Friday I fully expect it to arrive. We have notification that it has arrived in Ontario, which is literally across the bridge from where I live. I can see Canada from my house, and Ontario is right there. And there's a bridge crossing that is going to bring, and we want to bring our Canadian friends in. They come in with restrictions. They are vaccinated in order to come here, so we hope that as we welcome our neighbors, that they will not be bringing any unwanted guests with them. But we have to deal in the realities of a highly transmissible, we believe, variant, Omicron variant. And so I wanted to start with that and to let people know, first of all, we're fully monitoring this. We have some ways to defend against this. We are not defenseless like we were 1 year ago, and we all know exactly what has to happen. We know that it's an issue that we're grappling with right now. We have, the world is paying attention to this. So we're monitoring it globally. We're monitoring it here in New York State. And I want to talk about an institution that does not get the recognition that it deserves, and that is our globally leading Wadsworth Lab. I went and visited Wadsworth Lab during the heat of the pandemic. These are the individuals who worked literally day and night, round the clock, trying to be able to monitor the situation, but also more importantly, conduct the tests, travel, make sure that everyone had what they need to get through the early days of the pandemic. They are our frontline workers who I want to applaud them, the 700 members of the Wadsworth family who work unbelievably hard, and they're absolutely brilliant. We are so blessed to have the members of the Wadsworth family part of the New York State family. So I wanted to turn over the conversation, first of all, to hear it from the experts. You know from the beginning, I am guided by the experts, I'm guided by the data, I'm guided by the science. And there's an individual, Dr. Kirsten St. George, who's the director of virology at the laboratory there, and I wanted to have her zoom in for a minute and give us some of her insights on what we're expecting to see, what we know so far, and let me turn it over to her by Zoom. Dr. St. George, welcome.
Thank you very much, and thank you for your kind words, and thank you for the invitation to join this morning.
Well, we want to have you give an update, and we're all waiting with bated breath on what your announcement. Nothing found yet in New York, correct?
That is correct. We just checked the international sequence databases, the public sequence databases just a few minutes ago, and still nothing in New York, nothing reported for New York, and nothing reported anywhere else in the United States.
Okay. Can you just give us an update on what you're expecting and what Wadsworth is doing right now and what steps we're taking to prepare for this?
Certainly. So the New York State Department of Health Wadsworth Lab has been testing samples for SARS-CoV-2 since February of 2020. But these tests only detect the presence of the virus, and to thoroughly monitor for genetic changes in the virus and to track the introduction of new variants, we need to actually sequence the genetic material of the entire genome of the virus. We call this process simply sequencing, and it's a much longer, more labor-intensive process. And Wadsworth has been sequencing patient specimens to monitor for circulating strains in New York since March 2020, one of the earliest labs in the country to do this. And we do this continually on a subset of positive COVID specimens collected from across the state, a representative sample set. And the results of the sequencing and what it tells us about the strains and variants that are circulating are reported to those public sequence databases that I just mentioned every week, so that the information is available to scientists worldwide. And this open sharing of sequence data is a vital component of the global response effort to the COVID pandemic. And we strongly encourage all sequence labs to do the same. We very recently established a consortium of 4 labs in New York State to assist with the sequencing so that the surveillance of variant strains could be further expanded beyond what we were currently doing. And since the announcement last week of the emergence of the new variant, Omicron, we've done several things here. We first checked those public databases to confirm that the variant had not been reported anywhere from New York or in the US. And as I mentioned, just rechecked a few moments ago. We also sent a notification to all of the laboratories performing COVID PCR assays in New York State, requesting that they immediately notify us of any detection of a positive sample that has specific test results characteristic for Omicron. And we could then expedite sequencing to specifically identify whether or not it really was. Now, this is only a small number of labs that use tests to do this, but it's an important indicator to alert people to. There are now numerous other labs. Since March 2020, when we started sequencing, numerous other labs now around New York State and throughout the US that sequence the SARS-CoV-2 virus. And we therefore reached out to those labs and requested that they contact us immediately if they detect the Omicron sequence so that appropriate public health response measures can be initiated promptly. So there are many lab investigations that are needed on the new variant, and we are very grateful for the ongoing cooperation of the New York State clinical labs, the sequencing labs, the other public health labs across the country, the CDC, and of course the state's epidemiology team, so that collectively we can mount a rapid response and help protect the public of New York State. Thank you.
Well, thank you, Dr. St. George, for the update on letting the people of the state of New York know that we're on top of this. We're monitoring. We're having direct conversation with the various labs around the state. For example, if a test comes into a lab in Western New York, not unlikely given the proximity to Canada, that they're prepared, they know what to do with that information, so we can act with lightning speed to make sure that we get on top of this immediately and start tracking it, and then of course, the contact tracing that's necessary to make sure that we can limit the spread of this, at least for now, perceived to be highly transmittable variant. Is that correct? We're all set? All right.
Absolutely, we're all set.
All right, just wanted to confirm that. It's important to us to instill that confidence, as I've always had, but I want to make sure New Yorkers know that this is a real gem in our state, Wadsworth Lab. And Dr. St. George, please extend our gratitude to everyone who does put their heart and soul into the work. It's so critically important to keep New Yorkers safe, so thank you.
Thank you very much, I certainly will.
So, we talked about this variant. We know it's coming. But here's the good news. We're not defenseless. Compared to a year ago, we have so much at our disposal. Anyone over age 5 can get vaccinated. If you're vaccinated, you can get the booster shot if you're over the age of 18. We are recommending highly that people wear masks indoors, that they already have to. If they go out on public transit, you cannot go on the subway without making sure you have your mask on. You cannot go into a healthcare facility in the state of New York without wearing a mask. We've always encouraged mask use, and I'm asking businesses to encourage the same among their patrons as well as their employees as well. Some of the simple measures, the mask wearing, the hand sanitation, trying to limit your activity around other crowds. I mean, these are all the things we've been asked to do, but again, the difference between this year and last year is the vaccine. And of course, if you're not feeling well, stay home. Hopefully everybody gets the flu shot, because this is a season when people get sick anyhow. So we've been making these preparations even before this variant showed up on the scene, because we knew, and I've been talking about this for weeks, only a month, we knew this winter spike could happen. And so we are correct. The spike is occurring. You can see the number of people that are testing positive. We look at cases per 100,000 on a 7-day average. Look at some of these numbers, particularly upstate, Western New York, 65 positive cases per 100. Some of the other hotspot areas are the Mohawk Valley, North Country, and so we've been directly engaged with their elected leaders. I literally just got off the phone a few moments ago with the leaders of the Western New York region. I'll be speaking to the other regions, the mayors, the county executives, their public health teams, saying to them, as we have from the very beginning, we're here to help you. This is what we're doing. We encourage you to do the same, and let us know where you need more testing kits, where you want more sites, whatever we can do. We believe that the pop-up sites are very effective, but we're going to be layering in more mass vaccination sites for other individuals. There are some tough areas. We have been very successful in many parts of our state encouraging people to get vaccinated. There are some areas, and there's a direct correlation between vaccination rates and infection rates, but we're watching the numbers very closely. Some of the numbers aren't as high as we think they're going to be because of decreases in testing before the holiday. That's expected. So mark my words, we're going to see a surge in the next couple of days. And again, it takes about 5 days for it to manifest itself after exposure. So, okay, you sat down with your family and you invited Uncle Harry, who wasn't vaccinated, who sat right next to you at Thanksgiving dinner. You could be exposed and you could be vulnerable if you do not have the vaccination and hopefully the booster as well. So watch your symptoms closely, stay in touch with your family members, make sure you know what everybody's up to, because if there is going to be a surge in hospitalizations, which we'd be naive to think there won't be, that would occur about 10 days from now. So that's what we're watching for as well. Testing has always been important. We are up 42% in our testing from where we were a year ago. That is good news. We've been very aggressive in getting these tests out there to people, and part of our strategy dealing with the workforce, New York State workforce, is to have a vaccine requirement or a test, and so that's why these numbers are high as well. Last year we had about 10 million around this time. This time we have 14.2 million tests between early September and currently. So I'll be talking more about testing in a couple minutes. Just the overall hospitalizations. This is what keeps me up at night, making sure that our hospitals have the capacity to handle the influx of patients, whether it's from COVID or otherwise. And we currently have 2,829 people in hospitals right now. We've lost 41 people yesterday. How tragic that is, that right after the holidays that families have to deal with this searing loss. And so our hearts go out to all of them. So we know that the trend is continuing in a bad direction. You can see that heading up. Again, not anywhere near what it was back in April, but there is no excuse. This should be flatline. This should be going down because the vaccine is available, and we know that. So we want to make sure that we have more people vaccinated. Our numbers keep getting better. They keep getting better, but there are some holdouts. 90.3% have at least one dose. And what I want to make sure happens is that everybody's only had the one dose gets that second dose, because you're not fully protected without the second dose. We are sending text messages. We are aggressively going after everybody saying, come on now, I'm not sure when you got that or what you're waiting for, but get the second dose and then plan for your booster 6 months from then as well. So we want to make sure that we have people complete the entire series. Over 18, it's about 80%. Better than many states, better than other areas, but this is New York. We have the highest standards. We want to, after what we went through at the early onset of this pandemic, we want to make sure that we protect as many people as well. So get the second dose if you haven't already, and making sure that we're ready for the spike. So as I mentioned, we're ready for the winter spike. People traveling, people dining together. The winter surge may be here, or we're just at the beginning of it, and that's what we're focused on. So I'm focusing on preparing for the winter spikes. Since August, we've been monitoring very closely. The hospital bed capacity has declined. You can see the numbers here. Particularly the difference between upstate and downstate is rather stark. You see the yellow lines at the bottom there. That's the upstate numbers. COVID hospitalizations are trending upward. The number of beds is going downward, and that's a real problem for us. Since we've lost about 4% of our bed capacity since early August, that equates to about 1,580 beds. At the same time, hospitalizations and cases have gone up significantly. So this is what we're monitoring. We've lost, in fact, 70% of the bed losses are in upstate. That upstate lost 10% of its bed capacity, downstate lost about 2%. So hospitalizations are up, get this number, 150% upstate versus downstate. Not that I'm trying to create an upstate-downstate divide in our state. I don't believe in that, but just looking at the numbers, these are what the numbers we're seeing, and they're very, very troubling. Again, what I'm trying to present also, this is not a statewide phenomenon. It is not a statewide phenomenon. So this is how it's almost, in a sense, easier for us to deal with, because we know the targeted areas, we know the areas that we need to deploy the most resources, and that's exactly what we're doing. So I wanted to create a visual so you can talk about the hospital beds, because I'll be talking about the executive order in a couple minutes on why we had to do an executive order on Friday. This is very targeted. You look at the bed capacity, the Mid-Hudson area, 31%, New York City, 28%, Long Island, 27%. Those areas can handle the individuals who are seeking medical attention at a hospital. There's not a capacity issue there. So no broad stroke required for the state of New York. We're going to be targeted and look at specific regions and do whatever we can to protect access to critical health services. Finger Lakes, 9%, Western New York overall 11%, North Country's lower than Capital Region. These are the areas that we're targeted, the ones that you see in red right there. So how do we boost bed capacity? First of all, that's why I signed this executive order on Friday. This allows us to have the flexibility, what we call the surge and flex strategy. And one area we have power now to do this is to limit non-essential, urgent, non-urgent scheduled procedures at specific hospitals that have the limited capacity. Again, we know exactly the hospitals. We're talking about probably 32 to 36 hospitals right now that fall into that category of having 10% or less bed capacity, so we can micro-target those as well. Or those areas where we're determined by the Department of Health as needing additional capacity. And we're having regular conversations. I can't tell you all the conversations that are going on with health departments, various health professionals, and local health agencies with our health team here in Albany and in New York City. So beginning on December 3rd, elective procedures at these short-staffed hospitals will cease, and we'll reassess that again January 15th. Now, flexibility. Key to success. If they're able to secure the necessary capacity and their bed capacity goes up, we don't have to wait until January 15th. We're not going to just have a hard and fast rule that doesn't show some injection of reality into it. If they're able to manage this, they can get in supplemental staffing, they can address this, and we're working with them on. There's no reason why it has to go into them, but I wanted to give a range of time frame that we're looking at. And again, if it's still bad January 15th, we'll reinstitute again. This is the flexibility that I need to have as the governor to address this situation. So we'll reassess on January 15th. So essential procedures will continue, and people who need cancer treatment, mammograms, colonoscopies, have traumatic injuries, heart surgery, they will get the care they need. Again, many of those procedures to detect for cancer, mammograms, for example, colonoscopies, they also can be performed at other places other than hospitals. And we want to make sure that no one puts off critically important preventative procedures, as well as happened during the pandemic, the first wave around the second wave. And that ends up having long-term health consequences, and perhaps that's one of the reasons we're dealing with a lot of people in the hospital now, one of the other factors as well. So get those procedures done outside the healthcare system. But again, this shows our approach. It's making sure that we limit non-essential, non-urgent scheduled procedures at specific hospitals, but allows us to acquire, and also the executive order, the other reason why it's so important, it allows us to have more flexibility in securing more testing kits and getting them more widely disseminated, that it gives us what we had been in place in the early months of the pandemic that stopped when the executive powers were removed, and now we have those back now. So that allows our team to be scouring the nation and the world to make sure that we have an ample inventory of testing kits as well. So, nursing homes. We've been concerned about nursing home patients. We pushed very hard to make sure that they had what they need in terms of tests. We asked nursing homes to make sure that they had testing kits as well as the boosters available in-house so they could be administered before Thanksgiving. Before Thanksgiving, we surveyed them and we wanted to make sure that there was an increase in people getting the booster shot available. Many were vaccinated, as you know. A lot of focus on getting nursing home patients vaccinated. The federal government was all over this last winter. That was fairly successful. We want to make sure now that we have enough booster shots available. So we talked to the nursing homes and long-term health facilities. We told them to make sure that they had as many places available, that boosters could be available. We had about 90% of them respond and said that they would make boosters available before Thanksgiving. So we're anticipating to see a healthy number of people who received their boosters. We're concerned about the well-being of these more vulnerable populations and make sure that they're safe. One area I can add more staffing is the National Guard. We have surveyed our National Guard resources. We know that there are numbers who have EMT training or healthcare backgrounds, and we can deploy them in a targeted way to the healthcare facilities, the nursing homes and long-term healthcare facilities where they're having a shortage, because here's how it works. One of the reasons we have additional individuals still in hospitals who are non-COVID, who are ready to be discharged, is that the nursing homes don't have enough staff to take them. I'm on one call with an institution in Buffalo, and they said I could release 50 people right now, and that would take a lot of pressure off of them. But they don't have a nursing home to let them go to. So my question is, okay, how do we get more help on the back end? National Guard can step in. Some of the other programs we have, we're talking about the student nurse program, what they're able to do, how we get more nurses hired across the staffing services. So we have a whole broad-based approach to this, but working to increase the National Guard presence and also long-term. I said I want an order out there that I want to make sure our National Guard members start getting training to be EMTs, because we never know where we're going to need them. This won't start tomorrow. We'll start in January. It's a longer-term solution, but it's also going to be very helpful if they have to respond to a natural disaster or some other hurricane or storm, that they have this training. So we also believe that we can enhance the training capacity of our National Guard as well. And also, we've asked our downstate partners where there is plenty of capacity. You saw that, the hospitals that have plenty of capacity downstate. Some of them have agreed to help shift some personnel temporarily to our hotspot areas. So those are all the strategies we're dealing right now to deal with the nursing homes and the hospital shortages that we have upstate. All right, the booster update. Again, I keep talking about boosters. There's no reason not to get the booster as long as you're eligible. We have 2.4 million New Yorkers already vaccinated with the booster. That's great. We're also going to be layering in the flu shot as well at our sites, making sure that it's available when you go to a mass vac site, you go to one of the facilities, that you can also get the flu shot. Let's make it easier on everybody. Let's be ready for both. So I mentioned the long care facilities. I think I already addressed that. Here's the numbers on how many people had been vaccinated as of getting the boosters. These are already people who had the vaccination. This is the increase in people getting the boosters, the additional doses. As I was mentioning, we wanted to increase that. That'll go up higher in the next couple of weeks. We're very aggressive, making sure that every nursing home, as part of my executive order, now requires every nursing home to make sure that they have the booster shots available and that they promote them inside the nursing homes. There's a few reasons why it's complicated getting consent from people as well, but we're very focused on protecting that vulnerable population. So we expect the booster rate to continue to climb steadily after the holiday here. So we're going to have booster shots available. We're going to have nursing homes and everybody, I mentioned that already. Ramping up our vaccine and testing. Okay, we have our mass vac sites. We have a new one opening up in Queensbury shortly. We're taking appointments. Queensbury is a little bit in the North Country. We have been on calls with our county leaders. We say to them, if you want a mass vac site, we'll do it. If you're already focused on this but you need more supplies, we'll do it. Tell us what you need. We are there to help. And so these conversations are ongoing. We'll be ramping up vaccines and testing throughout the state of New York. And so we want to make sure people get their appointments. Go to this website, ny.gov/vaccine, or call in if you want to make a phone call. But these work so well. And we're very excited partnering with local individuals across the state, whether it's the religious institutions, the churches and synagogues that were partnered with us before. Pop-up sites work successfully as well. So we have a lot to do on this. Also, I'll be announcing more about, I'll be probably gathering with, do a press event on Thursday. I'm looking forward to introducing the new leader of our Department of Health, Dr. Mary Bassett. She'll be joining us. Also, we're talking about what we're doing would help children in schools. My goal is to keep kids in schools, keep them there safely, though, and making sure that we have the opportunity to have people test and return to classrooms easier than is occurring right now. And the state of New York is going to be very engaged with our school districts to make sure that they have all the resources they need, so this can be a viable option and not an expensive one for parents either, and pick up the cost. So those are some of the things we're working on. We'll have more to report on that very shortly. So we're going to continue focusing on our approach to this new variant. It does not have to be a broad brush, one-size-fits-all approach. We are targeted, but always have the tools to be able to deploy more widely if necessary. I know this is how we're going to come out of this with a stronger economic recovery, not to have shutdowns where shutdowns are not necessary, not to have unnecessary requirements where they're not needed, but making sure that any area that is showing vulnerabilities and we see a trajectory that is not good, that we're deploying the resources intensely in a strategic way to make sure that we're doing everything that we have at our disposal and making sure that we leave no stone unturned in terms of protecting the health of New Yorkers. Thank you very much, and I think we'll take a few questions from Zoom and then go to our in-person individuals.
Yes, Governor, thanks very much. Zoom reporters, please use the raise hand function in the bottom right-hand corner of your screen. We're compiling our list right now, so it'll be just a second. Okay, Governor, your first question comes from Jimmy Vielkind of the Wall Street Journal. Jimmy, your mic is open. Jimmy, go ahead and unmute your microphone, Jimmy.
Hi, Governor. Can you hear me?
Yes, I can, Jimmy.
Great. I hope you had a good Thanksgiving.
Very
I
nice.
was struck by the statistic about the reduction in bed capacity, particularly the disparity between upstate and downstate areas. How much of that, if any, do you attribute to the healthcare worker vaccine requirements? And given the numbers as what they are, is there any thought to amending or perhaps allowing more religious exemptions to those requirements as they stand now?
There is a somewhat of a correlation. It is not the sole reason by any stretch of the imagination. There's other factors involved here, Jimmy, and one of them is that there's a closer correlation to hospital capacity and the vaccination rates in areas. If all those upstate areas had a 95 or 100% vaccination rate, we would not be having a surge in hospitals. So that is number one, the differential between upstate and downstate in one sense. Also, with respect to the vaccine mandate for healthcare workers, I will not be backing off on that. That is something I believe worked. Every single individual who enters a healthcare facility because they're sick and they need someone to help take care of them and get them well should never have the fear that they're going to contract COVID from the person charged with taking care of their health. So yes, there has been an impact. We have lost some workers. That is regrettable. We encourage them to get vaccinated and come back to the healthcare family. I know they're dedicated individuals, but I can't change a policy because of some individuals who made that personal decision. That is why we are working very hard to backfill, and that includes, and I'll be announcing more on this later, our effort to bring in more foreign workers, working with the White House, who I'm having conversations with, to bring in more nurses who might be available globally. It's not that easy. There's not a lot of supply out there, but again, the executive order allows me to use more creative means to find workers to come to our state and backfill. Again, talking about deploying people from downstate, talking about bringing in the National Guard, talking about our student nurse pool. We are looking at every option to make sure that there is not this crisis. But it's a combination of many things, but I think number one, it is the fact that the vaccination rates are significantly lower in some of these areas.
Thank you, Governor. Your next question comes from Mary Keelar of WSTM TV. Mary, your mic is open.
Hi, good afternoon, Governor. Thanks for taking my question.
Thanks, Mary.
So just wanted to circle back to you asking, or you talking about the 32 and between 32 and 36 hospitals that you would consider the hotspots for really dealing with lower bed capacity and understaffing. Is Upstate University Hospital in Syracuse one of those hospitals?
Let me check on that. I don't have the list right in front of me. And also, that is our number today. This requirement with respect to eliminating the non-necessary elective surgery, I guess that's what the nature of elective means, goes into effect on Friday. We anticipate that number of 30-something is going to drop between now and then as the hospitals understand how serious we are about this, and they start bringing in additional support that they may have been hesitant to do for cost purposes or whatever. So, and also our efforts to help them. So that is the number today. I do believe it'll drop, but we're going to monitor it. I mean, if this new variant takes this state by storm and the vaccination and the boosters don't fight it as much as we hope that it will, and we just don't have enough data right now, then we will be looking at perhaps even a higher number of hospitals that are in trouble. That's why we took strong, decisive action at this time to deal with a situation that is manageable upstate, but to make sure that it doesn't spread like wildfire and get out of control in light of this new variant certainly coming to our shores if it's not here already.
Governor, your next question comes from Kelly Dudzik of WGRZ. Kelly, your mic is open.
Hi, Governor. Thank you for taking my question. As you know, in Erie County, we have a mask mandate. Have you been talking to leaders here about potentially moving on to phase 2 sooner than December 13th if the numbers keep going up like they are?
Phase 2 of the mask mandate that was instituted by County Executive Polenkars? That is his decision. That is his decision. And I told him I support what he's doing. I spoke with him again this morning. I speak with him often to make sure that we're doing everything we can. And so we also are working closely to help leave the pressure valve that's on the hospitals right now. So I support his mask mandate, and I encourage other leaders to do the same. I mean, that is something that takes courage. It's not always the most popular thing to do in certain areas of the state. It is in a category of like, of course you will. That is a differential that exists right now in our state. It's a reality we know and understand, but that'll be up to the county executive to go to phase 2 if he chooses. But we're working very hard to control this and deal. Again, my number one concern is hospital capacity, to make sure that anyone who needs hospital care, whether they have COVID, and if they have COVID and they're not vaccinated, we're dealing with that. It doesn't. Those are the category if it does not have to be that way. But also other people who need medical attention should not be denied that because the beds are filled up with COVID patients, especially in the ICU.
Governor, your final Zoom question comes from Shannon Young of Politico. Shannon, your mic is open.
Hi, Governor. Just wanted to know if you had any conversations about adjusting visitation at nursing homes. I know the state recently said it was going to back federal guidelines that let pretty much anyone into a nursing home, whether they're vaccinated or not. Has there been any discussions on whether to limit that or require vaccines or anything like that?
Well, we have had discussions, and we certainly were required to ensure that we comply with the federal dictate. I mean, these are federally funded institutions primarily, and we've had to follow their directive to allow any guests in. And that was in response to the realization that it ended up being a very harsh policy for family members, especially when someone is vaccinated, and now that we have the boosters available. So we talked about this, but my laser focus is providing not just the vaccine, but the booster shots, so the vulnerable population who live within the nursing homes are safe when someone comes and visits. Obviously, everyone has to wear a mask when they're in there, but we're having those conversations, and again, flexibility is key. I'm focusing on what's going on in those nursing homes. I hope we'll see in another week many more people have had their booster shot, and that'll give me a higher level of comfort knowing that they're safe.
But just so I'm clear, is there anything that the state could do to say that they're not going to support those federal guidelines?
Well, we talked about it, and we have a high number of individuals who, 97% of people work in nursing homes and long care facilities are vaccinated themselves, and so we know the staff is protected. We know that many more members of and I can get the numbers on how many people have been vaccinated and have the booster shot in nursing homes. So it's a very different dynamic than we were experiencing last year or the year and a half ago, when there was such a huge vulnerability when anybody walking in the door, whether it's someone who was a kitchen helper or a delivery person, could expose them. There weren't even mask requirements for a long time early on. So that has all changed, but we're going to look at those numbers. We are not seeing high numbers of nursing home people entering hospitals right now. If that changes, we can turn on a dime. Right, go ahead.
Governor, are you concerned about possible COVID fatigue, people who have said, okay, we locked down, then we got the vaccine, the mask, then we did the Delta variant, and here we go again. Are you concerned about that? And if so, what can you do about it?
I am very concerned about it. That is the reality we live in, especially in areas outside New York City. You just look at the numbers, and people have said, we're over this. And the numbers were not as high in other parts of the state during the early months of the pandemic, where everybody heard the sirens here, and it was a time of great anxiety. But there are leaders all across this state, and I commend the county leaders who are doing the right thing and are just reinforcing this message. It is not fun to be the person who has to keep saying, okay, it's not over yet, we have to keep doing this. But I'm saying this in the context of we want to get back to normal. We want to get to a time when our children are not wearing masks in schools. We want to get back to the time when no one hesitates going into a workplace or ever getting on a subway. All those are within our reach if people will get vaccinated and get the booster shot, and we're going to continue monitoring through this season. We've said for a couple months, let's see how this winter surge plays out. In January, February, let's just assess. We may be in a far better place. So it's, in my opinion, it's a little more short-term pain with the hope of long-term gain. And that's what I'm asking people to do, is just stay with us. We've gotten this far. I'm really proud that 90.3% of all New Yorkers over the age of 18 have been vaccinated. That is something that other states, vast majority are not. So they've done the right thing. And I believe that those people who did the right thing and got vaccinated understand we cannot control a variant that arises from South Africa. What they've done is all they can do. We're not talking about shutdowns. We're not talking about reinstituting the harsh measures that were needed at a time when we did not have any defenses. We had no defenses. We had no vaccination. The tests were in short supply. We are in such a different world right now. So it's still a time of concern. I am very concerned about this, but we know so much more. We've done this before. We know what has to happen. And if we can just ask New Yorkers, just hang in there with us a little bit longer. We will get all of our beloved activities back up. I'll be lighting a menorah tonight. We're going to be, the Christmas tree at Rockefeller Center, the ice skating. All these activities are great. Just get vaccinated, wear your mask, and you won't have to worry.
Governor, since you're saying short-term pain for long-term gain, given that international health experts are saying we won't know for sure if the current vaccines can defeat Omicron for about 2 or 3 weeks, why would you not do more than praise the Erie County Executive's mask mandate, but be more aggressive and implement your own statewide indoor mask mandate until you get that information about whether the vaccines work?
That is an option, but there's also a reality that's out there. And the people who will not get vaccinated are probably the same people who won't wear a mask as well. So now we're taking the shift off of the individuals that I can help. I can help people who get sick enough to go into a hospital. I can help them. And I want to make sure that we're focused on that. That's exactly what I've been talking about today. And we'll consider all options. But right now, to have a widespread approach, you saw the numbers. We have some hot spots. The areas, in an area like Erie County, they have taken an action that across the state may not make sense for people, where they've done the right thing, they've got lower numbers. So I'm very strategic, I'm very targeted in my approach to this time around, because we know so much more and we have vaccines and boosters available. So that being said, I am keeping every option on the table, always have, always will. A couple months ago, did we anticipate we'd need an executive order? No. We took that action because it was necessary at this time. So any action that I determine to be necessary to protect New Yorkers, I will always do that.
Is there a metric that you have in mind that you would hit, or you would impose some kind of mass restriction, or even possibly restrict movement if it got bad enough? It does seem like last fall there was a slowness in the response, and the numbers surged in a way that was very difficult for New Yorkers.
We're watching the numbers. We'll know very soon about whether or not the vaccines that we have in people's arms right now and the booster shots, whether or not they're going to resist this new variant. If that ends up being no, and basically no one is protected, which I don't foresee happening, but if we get that kind of news, at that time we'll have to take actions. All right. Thank you, everybody. Appreciate you coming out.